The sooner we get started, the sooner most of us can go home.
Well, Senator, I did as you asked, and I put together about a 2.5 hour presentation, and I got about 96 slides. So as soon as I can get through with that, you're more than welcome to head on. Shouldn't take long at all.
You're fired.
So I went back and looked through all of those and ended up with about 8.
They're good. So, you're a smart man.
Yes, sir.
You're a smart man. First off, Kirk, I'm assuming Kirk had a pretty good rendition yesterday about the forecast and such. I hope everyone listened to that because I don't intend to call him up and redo that every day. I think he has that online in case anyone is interested in where we're headed or where we think we may be headed. With that, we'll come to order and we'll get started. Let's hit it. Mr. ALEA.
Good morning.
Thank you for being here.
Yes, sir. Thank you
for
for having me.
preparing for this and for our discussion the other day. I look forward to it.
Yes, sir. Thank you for having me, and thank you for your time and everything that y'all do for us. And I want to thank you right off for what we got for the upcoming year. The handheld radios, which was much needed. We had no communications outside of the car once we got out, and those we really needed those. The cameras, body worn, we had. They need updating. We did not have in-car, so you gave us money for in-car, which is huge as well, and thank you for that. Vehicle replacement, $5 million, and they're going up. I have slides here to show that those cars are going up, and they're going to be even more harder to get with police packages. Source of funding, you see there, and in your packet, this is in there as well. 41% local fund, 41% general, 18 other, and less than 1 from ETF. That's about $545,000 that goes to Fusion Center. I've showed these before. I wanted to show them again just to let you know what we're dealing with, because what I'm looking at from our budget is hiring and equipment. Because with what's going on around our state now, in cities, we're helping Montgomery now. I feel like we're going to be tasked and asked to do more with some of the locals that just don't have the resources to hire and do things, some of these smaller agencies, and we're here to help. We're willing to help. I'm going to need boots on the ground, sworn, SBI, whatever it is, to go help some of these people that need help. So I feel like that's where we're headed based on just the climate of, and it's not any new news, I don't think, to anyone. I think if you watch the news every day, you see where we're headed. And I think they're going to need some help. So our salary is competitive, $55,000. That's competitive with other surrounding states and other counties and municipalities in the state. Retirement, health insurance, subsistence, Medicare, $96,000 for a total for salary and benefits. Uniform and equipment, outerwear, protective vest, it's about $9,500. I had these, I just went through just to show you how much things have gone up and what it actually cost to put a sworn officer on the road. Pistol, body camera, flashlight, protective vest, vehicle and equipment. That vehicle's $36,000 on this slide. It's actually going up about 4. It's about 40 before we put any conversion on there, patrol conversion, lights, siren, portable equipment, which I'll show you right here. It's about $85,500. So here's what that is. You got a computer docking station, radar, radio, which that's all we had, that radio, until y'all helped us with the walkie-talkies to get out of the car, so that's huge. Here's other parts of the car, cage, weapon lock. Here's the trunk, jumper cables, AED, fire extinguisher, things you have in there. But all that totals up, salary and benefits, uniform and equipment, vehicle and equipment, certification and training to $200,241 to put one sworn trooper on the road to work. And as you know, as things are going up, everything else is going up with ours as well. Our numbers goes from, you can see there in your packet, 16 to current. We have 378, I'm sorry, 387 patrolling now, have 763 sworn, 613 civilians, and a total of 1376. Graduated class of 25. You have a question, sir?
Just noticing in your uh, slide here, so in 2016 we had 1,280 troopers, and now we're up to 1,376. So we're almost have
Well, look, that's
a
a
thousand. Is that
that's a total of that's civilians. That's not just sworn.
okay?
Look right above that 1280 mark in 16. You see 719. That's sworn. Now that includes the number above that is 292. That's patrolling. That's corporals. Am I right about that? Corporals and down. Sergeants and up are not included in that. Marine Patrol is not included in that. Aviation is not included in that.
Yeah, you've got the total number broken out in each one of those.
Right.
Okay.
So we graduated a class back about 6 or 8 weeks ago, 25, and we're hoping to start a class in September, 1st of September, graduate in November, of about 50 to 60. It took, and I know there's different things going around about how many applications it takes to get to that number. It took us 203. So to go through, and as Chairman Reynolds well knows, by the time you go through 203 applications, background checks, polygraph, and do everything you do, we're down to 78. So all those won't make it. So we'll probably end up with about 50 to 60, I hope. And
Secretary
then
Taylor, remind me, what number do we have you funded at for full staffing?
sir, I don't think there is a number.
Okay, okay.
Now,
We gave you some additional funding, I know, for personnel, and it
Yes,
sounds like
sir.
you've been pretty successful on recruiting troopers, so.
we have.
Okay,
We really have, and that's what I was talking to Colonel Archer about. Is we have had really good success at hiring, better than some of the other locals. So we want to continue that trend.
good, good.
Um,
And to back up in my comment, I appreciate your comments about, MOAs, MOUs with these other agencies and ability to success. The speaker held a meeting this morning at 9 in his office, and those conversations were going on about multi-agency support, and so some of these are going to need resources. I know in Huntsville, we've called on you several times, and you've been there in force, and I know that's a price tag that goes with that, so we appreciate those comments.
Yes, sir. You're very welcome. And I couldn't do it without your support. The number of people and the cars and the equipment goes with that, as you saw, and y'all have helped with that. And I thank you for that. But I'm going to have to continue that because of the trend that's coming. I feel like I'm going to need more, as is everyone in this state. But on us to help with investigations and things like that, where they just don't have the resources. Our SBI agents are going and helping anytime they can. We work pretty much all officer-involved shootings and pretty much all in custody deaths now. We have MOUs in place that we do that now. But a lot of times we're being called for just help with a regular case because they just don't have the personnel and manpower to do it. And we're going and happy to do it. So back to that 387 up there, hope to get that up with the 50 or 60, and then in January start another class. So we'll start in September, October, going through applications again and working from 200 or whatever it takes to get to January to hopefully get another 50 or 60 there. So,
Secretary, if I may
yes, sir.
intercede on that, and I appreciate the comments, and I appreciate your efforts and everything on going and doing this. But as we move into, and as you're discussing, we're developing and MOUs so that you can cross over and get protections and understandings who's doing what. But is there a cost sharing involved with that, or is the state picking up all the cost of time and such that's involved with this, or is the municipalities or counties helping with those costs?
They aren't, as of now, we have not needed it. We've been able to sustain and help with what we're doing now with what we have. Chairman Reynolds mentioned a fund that he knows about that there's a couple of $1 million in there that's dedicated for overtime when helping municipalities and counties and other agencies that we could use if it gets to where we can't sustain that anymore. But right now we're able to do it.
Okay, we're able, because of the budget, the state budget is assisting and doing that at state cost.
That's correct.
Okay, just wanted to clarify. Thank you.
We are, and just as a follow-up, it was talking about the disaster recovery fund. The legislative intent there was, we used to have federal funding for our assets to move from one location to another, both for police and fire, right? If Huntsville had a responding SWAT team went to another city, we could get funding for that because that was that regional response capability. And we don't have that anymore. And I guess every time our SBI goes in and works an officer involved shooting all over the state, you don't get a penny from that local, right?
No, sir.
Very good. Thank you.
Yes, sir. Thank you. So hope to get that number up. So here's what I'm working with, though, or working against, because in 24, which we got 3 more months left in this, there's 81 potentially could retire. I've had 26 retire, 42 separations. So that's a total. So those will bleed over into 25 with those 17, but they can potentially retire. So I'm at a wash with one of those classes that I have coming up with the retirees. So I'm trying to have more coming in than going out. And if I can get this class and the other one in January, then I'll be heading in the right direction.
And I was getting to a point of commending you that we have more people, more troopers on the roads. From looking from 16 to your numbers, 16 to current, we have about 95 additional. That's at least one more trooper per county.
That's right. Yes, sir.
And beyond that, so we're making we seem to be making some progress along that line.
Right. And
same thing now, and then the sworn numbers also have gone up, which is the other matters that you're talking about, I suppose.
It is, and helping with anything from aviation when we're looking for a missing child or an elderly person, to SBI and some that's in our SWAT team, multiple other divisions that have sworn that go in that all sworn. Yes, sir. And that's all I have. So the other 96 slides I left off, Senator.
I have a quick question on funding.
Yes, sir.
I had the question in my head before I saw the spreadsheet that LSA put together for us. My question was going to be, the Fed and local funding, is that a known and stable source, known and stable number? And then I see it's $2 million less from 19 to 23, which is $11 million less than 21 and $10 million more than 22. It's very,
back and forth.
yeah. So is there a known calculation at least for that on how we get
some of that's funding? Homeland Security money that we used to get a lot of.
It's what, I'm sorry?
Homeland Security money. It's grant funding, and it's back after 9/11. You had a lot of it. We had a lot of Homeland Security money. A lot of other states did as well. Yeah. And over the years, it's dwindled down a little bit. We only get it's passed through for us. We get a few $100,000 for that, and then we issue that out to whoever makes application for it, whether it be fire department or police department or whoever from fire equipment. Senator Allen, I know he remembers we helped one of his fire departments that burned and helped them get some equipment. Burned to the ground, helped them get some equipment. So I say that because it's passed through, and then every year it changes. One year it may be $2 million up, and the next year it's $3 million down.
It doesn't matter anyway, right? If it's passed through, it doesn't affect your operation.
That's right.
So how are you on? And I'm asking this from a mayor's perspective, from my prior elected position. Your funding for ammo and training. Are you where you want to be on that, on y'all's preparedness? And
well, sir, when you ask a question like that, I never have enough money to do anything. I know
well,
that. So if you're
that should be a private question, not in public.
Right? Because
you're right.
No, sir, I do not have enough money. Yes, sir, we do. We're okay. Ammo is going up. That's
right.
like the cost of everything and those other.
Right.
It's with that. Everything's going up. So eh, we're trying to sustain, but right now we're okay with that. But as we hire more and go to the range more and train more, we will use more ammo. You're correct.
Thank you so much.
Yes, sir.
Go ahead.
Thank you for coming today, and I
Yes,
certainly
sir.
appreciate it. I just had a quick question. I wanted to look into the expenditures that we were giving. We had a 5-year look back onto 2019, 2023. The professional fees and services went from 14 million to 27 million, which was it says a 92% increase. What makes that up? And that was a big jump.
All right. So
So last year in 2022, it was 18.6, and then it jumped to 27.4.
in that professional services is Axon, which is our body cameras.
So that made up that.
That's part of that. And then there's a storage fee that goes with that for all that data. We have FAST, which is our driver's license system. That's part of that. We have our academy food service. That's part of the services. We contract that out, and then at the academy, we have finance software through OIT and things like that we have to pay back. Watch system. It's a lot of CGIS stuff and a lot of OIT and IT equipment.
Was it a lot of one-time purchases?
Yes, sir. That we had a CCH, which was a updated fingerprint system that y'all gave us money for a couple of years ago, and that's part of that. It was a one-time purchase to go in and revamp the whole thing. So that's why that looks a little, and that's why it is
Skewed.
higher. Yes, sir.
Thanks, Secretary.
Yes, sir.
Thank you, Mr. Chairman.
For clarification, we're talking about the first line federal and local funds, 89, almost $90 million in 23. On the expenditure side, down below, you've got grants and benefits is 6.6 million. Are those two correlated? I mean, the grants, that's where you're sending monies out and pass through stuff.
That's passed through, yes, sir.
That's passed
like
through.
I was talking with him, that like
Exactly.
Homeland Security.
So that 6.6 may be a part of the 89, but the 89 is not all pass through.
Correct. That's correct.
Okay, just double check. Oh,
Yes, sir.
Any other questions for anybody? Yes, sir.
Thank you again for being here, and thank
Yes,
y'all
sir.
for everything you do. And I just got a question and kind of follow up a little bit on the answer a while ago you gave Representative Whitt. As far as your new computer system, and you said that is part of the expense in that 27 that we're looking at there. In our contract with them, that expenditure over the last few years has continued to go up. And I know we redid that system, 2 years ago? Is that correct?
Yes, sir.
And so, are we going to continue to have those type of maintenance fees with the company that we're with, or you're with at this time?
We probably will for a period of time, and I don't know how long that is. The IT people, if you don't have that support when the software or hardware, whatever you have, gets to the point to where they don't support it anymore, they meaning the company, then if you have those people to support and you paid that, they'll come in and help you and update software and update hardware and things like that. If you don't, then it expires, and then you start over. You start either buying new equipment or asking them to come in and support something that's old and outdated. So we found that paying that support and having that support is beneficial and more or less expensive to have them. That's the way it is with our driver's license system as well. We have those people that we have working on my IT people could not hire the people and pay them to do what we pay them for.
And and I appreciate that answer. My only concern is, and I know that your guys in the field need the information so we need to make sure everything is updated. I'm just asking for us to, this has been a continual increase. And in the real business world, a lot of times, if we have a company that is continuing to milk us in one term, that maybe your IT people uh, may look at other alternatives to where this will not be a continual drain, because every year for the last 2 years, this has been an additional increase above what it was anticipated to be.
Okay.
Thank you.
Yes, sir. You're welcome.
I'd like to spin off a little bit on Senator Price's comments too. Um, this is not accusatory in any way, but it is frustrating from our side that every time a new iPhone comes out, we have to make that purchase. Now that's a slight exaggeration, but not by much. And whether it be hardware or software, the IT folks have that hook that is portrayed as a one-time money, um, but it becomes one time over and over again. IT is, and put this into perspective, AI is coming online. Uh, that's going to be a huge factor because not only of its capabilities, also because of the capacity it's going to eat up. That's going to outdate uh, um, much of the hardware that we have. So there's some concerns as to where we're going to be in another 18 months to 2 years after making heavy investments, is having new equipment out there. I mean, uh, it, it's a concern because as soon as the state buys and does this, all the municipalities and all the counties become outdated. And then they have to make the purchase. It's a cascading effect that has huge sums tied to it. And we sometimes get our tunnel as to trying to make sure that we're all up to date. And the that is a costly feature. Um, from my position, anytime I hear the terms update, whether it's on the phone or something else, I have to take medication. So anyway, just a comment.
I think, Secretary, remind me, I think some of that may have been one-time money, right? For
It
the
was.
upgrade, and then there was also some increase in cyber funding, right?
That's
cyber
correct.
infrastructure. So
That was the
some of that
one-time.
may
Yes,
be
sir.
one-time money.
Yes,
Thank
sir.
Well, any other questions or comments? Well, we've missed the other 96, but we'll look forward to, instead of a slideshow next time, we'll look forward to the video.
Okay.
All right.
Sounds good. Thank you. Thank you for your time.
Secretary, thank you for all
Yes,
you
sir.
do. Your staff's here. I know. Appreciate each and every one of you. I always brag on you, but I was traveling in Virginia and met with an agency up there, and they were bragging on Alabama law enforcement. So that made
Good.
me
Well,
proud.
thank
so
you.
Appreciate it.
Thank you for all your support.
We'll take a few minutes, let Commissioner Boswell get here, and we'll be ready to go when she arrives. Are you ready?
I'm ready. Are you guys ready?
We shall see.
We shall see.
Thank you for coming in and being here present. And now I see that the list. Okay, uh, according to our prior conversation, the intent is for us to make this an open discussion, and these are for reference as we get to the topic. Is that accurate?
It is accurate.
All right.
We're going to do our best to have a discussion.
Good. Then, if you don't mind, I'm going to start out, if I
Okay.
might. All right. Um, it's always dangerous for me to go off the cuff like this, but there's not a single day. There's very few days that pass me by without having a mental health issue come before me on the phone, in some confrontational way. Um, Now, that doesn't mean everything falls under your department, because many of them come out of DHR, many of them come out of probate judges, many of them come out of sheriffs, many of them come out of probate courts, many of them sometimes come out of mental health courts or regular courts, juvenile courts. Sometimes they come out of the blue, but sometimes they come from the gas station with people that are running around or whatever. These issues are always out there, but they don't always come within your purview. My point in that is that mental health is a very broad matter, and I may be overly stating this, but it doesn't seem like there's any single one individual or one agency that has control of all of it. And many of them that have charge of a piece of it can only deal with symptoms and not with problems. The issue yesterday was that we were dealing with a juvenile, and yet the problem was with a parent. The juvenile was being cared for, treated. No one was dealing with the parent. Where the root of that problem is or lies, nobody was dealing with it or was aware of what the root was.
Yeah.
My point in all that is, in Alabama, we seem to be trying to deal with symptoms and circumstances that are all around us, but we don't have a concerted or clear plan for anyone to do anything with anybody. Now, again, that's an overstatement, but it seems like we are in a chaotic place. So I'm not sure that we have an answer completely on that. Now, having said that, I want to start out with crisis centers.
Okay.
How many we got operational? How many are fully staffed? How many of them are fully occupied? How many are we building? And where are they? Now, that's just a couple of questions. And
Okay.
I'll let you start out with that, and we'll move along from there. Is that okay?
Perfect.
Thank you.
Yes. So we have 5 crisis centers that are fully operational right now, today. Huntsville, Birmingham, Tuscaloosa, Montgomery, and Mobile. We have a 6th crisis center that will be opening in Dothan this summer or early fall. So Spectre Care in Dothan will open. And then we are also in the process of working on a rural model with South Central Mental Health Center in Andalusia. So we have, they just got notification that they received a USDA grant to build their crisis center. And you guys dedicated $3 million in funding for them last year. And so that is where we are with crisis centers currently. To have those services across the state, we know we need 11 crisis centers statewide. If we go back and look at the services, we hit a pretty big milestone. We have now served over 12,000 individuals in our crisis centers across the state. That's huge for us. That means over 2,000 people who avoided jail and went to a crisis center instead, and then 8,800 who avoided the emergency department. So those numbers are pretty huge. Obviously, there's still a lot more work to do. We don't have crisis centers in all of our counties, covering all of our counties. We've seen an increase just looking at the folks who are showing up and the reasons why they're showing up. This gives you a little bit of an idea of the growth from 2021. So May of 2021 is when we opened the first crisis centers. And as you can see, the longer they're open, the more people they're serving. Substance use is another issue that the crisis centers address. So it is serving as that integrated care model. So whether you have a mental health issue or a substance use issue, you can show up at a crisis center and receive services.
If I might,
Sure.
we have 5 crisis centers. How many total beds is that?
That's a good question. The beds are ever changing. For example, in Tuscaloosa, they're opened in a temporary space and they have a lower number of beds. I'll need to get you that number because they do change as the crisis centers grow. And so for Tuscaloosa is just a good example where they're building a new building, and when that center opens, it'll be larger. So I do need to get you those numbers.
If I could get an average, if I might, just an average number of beds and also
Okay.
average occupancy.
Okay.
All right.
And I think the other question you asked about was staffing. So here are the staffing numbers just for the crisis centers. 414 budgeted positions for crisis centers.
What?
13.
13. Thank
Yeah. So do need to remind you, though, these are employees who are employees of our community mental health centers, not for the state of Alabama. So these employees here are employees of your local community mental health centers. So there are 414 budgeted positions for crisis centers. They're currently at 327. We do have 29 positions budgeted for 988 call centers. They're at 26. And you can see for mobile crisis teams, our child and adolescent mobile crisis teams, which is an initiative we have with DHR. Those mobile crisis teams are focused on kids who are at risk of being in DHR custody. And then we also have some other mobile crisis teams that are funded through state dollars. So they're at about 78% filled positions at this point, which is really actually a surprising number to us. We were very pleased to see these numbers.
What type of training or credentials do the people have in crisis center?
So many of when you're talking about an inpatient setting like a crisis center, they are required to have master's level therapists in the crisis centers. There are a lot of different levels of professionals within that setting. You do have to have a physician, a medical director. We often use nurse practitioners, psychologists, as well as social workers in those locations. Great. So I mentioned child and adolescent mobile crisis teams. This just gives you an idea of the number of children we're serving through those mobile crisis teams. We serve 752 children, and then we served 5,473 adults through mobile crisis services. So I think I'm going to shift to a conversation about our youth mental health crisis, if y'all are good with that.
That's fine.
Seems to be a lot of discussion about kids, for sure. Do you want to go back to our collaboration with
You have
DHR?
a question?
Yes, sir.
I guess more of a statement before we get off the crisis center. I will tell you that I sat with some of the mental health professionals in Birmingham last week at a conference, and I will tell you overwhelmingly from the audience there that are all professionals in your field, they feel like the crisis centers has absolutely increased access to mental health in Alabama, but they also feel like that they're full as soon as we open one. But I guess, and you've heard me say this publicly, is I do think As we, and the chairman and I have talked about this, before we continue to grow additional crisis centers, we've got to figure out a steady funding mechanism. And I know during the gaming package, during the last session, that's why we had mental health in that. That did not make it last session, as we know. And so I think we have to kind of rethink that, because I guess I look at it as the traditional mental health model for all these years, and now we're adding a different crisis system of care to that.
Right.
I just think we have to begin to think about areas of the old traditional mental health to where we can capture some savings, I think, to pay for this new vision that we absolutely believe is working. I mean, is that fair to say?
It is. So I'm going to pivot a little bit and talk about money since you brought it up. So you guys have made significant investments in mental health care, the general fund, and I just want to take this opportunity to say how grateful we are for the investments that you've made in providing services to the citizens of Alabama. I did want to share this graph. The big thanks for digging us out of what was a pretty big hole. If you look at this graph in 2010, the department experienced a $43 million cut due to proration. That hit the mental health side of our program much harder because that's where our state dollars really were. Our DD program is primarily funded by the feds. It's an entitlement program. We really couldn't cut those services because if we did, we would have been in a lawsuit. And so our big cut was to the mental health program. And what you'll see is we are just now, as of 2022, getting back to pre-proration level funding. And it's huge. The investment is huge. It's a 95% increase, $102 million that you guys have contributed. And the majority of that is going to crisis services. 50% of that is going to crisis services. So if you look at how much of that is going to inflationary or infrastructure versus how much is going to service growth, 79% is going to that service growth and 21% is going to inflationary increases. I will say that during this time, you see the red on the screen, we did nothing in the way of infrastructure for our community mental health centers. There was no funding for COLAs. There was no funding for any kind of infrastructure within that community mental health system. And so the inflationary and infrastructure growth, that percentage that we're seeing now is the first time between 2010 and 2018 that they've seen any kind of increase in inflationary or infrastructure growth. So thank you. So
look, we have, we know that there's an issue. We know that there's problems here. We're trying our best to address it with the resources that we have. And since we're speaking of money, the concerns that we've got are, of course, is future with where we may be. Have been on a growth pattern, which has allowed us to do this. Concern is when we'll have a reversal of that.
Right.
And while we need and want to have and follow a plan, circumstances may interfere. So we're trying to figure out a plan or a path that we can actually accomplish.
I appreciate your thoughtfulness about it. I was the HR director at the time we hit that proration when we shut down 3 state facilities, so I remember it well.
One more question here.
Can I ask you a question about those state facilities that were shut down? Was that in 2010?
2010 and 2011,
Yeah.
we shut down Searcy in Mount Vernon, Rural Hospital in Montgomery, North Alabama Regional in Decatur, and then we shut down our last developmental center, Partlow in Tuscaloosa.
So the difference between then and now, with the 95% increase, 102 million, is we're no longer funding and concerned about those facilities, but in place of that, we've built, is it 5 new
Right.
crisis centers, correct?
Correct.
So that's kind of where we've taken our direction overall is from a centralized, you know, however many you mentioned, to these crisis centers, and so that's kind of the difference between 2010 and
Yes.
today.
Correct.
So the funding is just funding more places in more parts of the state. Uh, the average stay for people at those is it longer or less than it was at the centralized, um, more centralized?
It's significantly less. The stay for a crisis center on average for crisis stabilization is 5 to 7 days. When you look at our state facilities, those facilities were there for people who were under a civil commitment.
Yeah,
So they were staying for a much longer period of time.
like months and years or more.
Right. Correct. Months and years for
Okay,
sure.
thank you.
Yeah. This is the big transformation. This is a big part of the plan uh, to prevent people from getting to a point of going through a civil commitment. If you have 24/7 crisis services and you can prevent that situation from escalating to a more serious situation, then you intervene earlier and those people get treatment earlier, and hopefully you prevent that civil commitment.
Do we still have a gap though? But for those that do need a longer time frame, is there still a gap there? You think as far as the needs of the state?
Yeah,
And I'm jumping. I
there
know I'm
is.
jumping. Probably jumping.
That's okay. There is a gap that we have been talking about. Let's see. Let me make sure I know. 29. So we do have a gap in civil commitment beds, and what we
What slide number's that?
29,
Thank you.
and extended care beds. Um, and we really thought that we were making some progress here, but we have definitely hit a couple of challenges. We are working with the Association of County Commissions to utilize some of the local opioid funds to help treat what we call co-occurring disorders, people who have a mental health issue and a substance use issue, and working collaboratively with them to figure out when someone is going through that civil commitment proceeding. And the sheriff and everybody in town knows that not only do they have a mental health issue, they also have a substance use issue. And if we don't treat both of those, then they're going to wind up right back in the court system. And so this is the work that we're doing with the Association of County Commissions and looking at how can we embed substance use care in our existing civil commitment beds so that people get that treatment then. How can we get that assessment for people who may be in jail and need that substance use assessment, and using some of those local dollars to fund that initiative? One of the things we did when we closed the state hospitals is we put 16-bed crisis residential units out in the community. Why 16 beds? In the federal world, there's something called the IMD exclusion, and our state hospitals fall under the IMD exclusion because they're greater than 16 beds. Less than 16 beds, you can get Medicaid reimbursement. And so when we closed state hospitals, we put 16-bed residential treatment programs in the community because we could combine a little bit of state dollars with some federal dollars so that the reimbursement rate would be better. That's why we don't ever talk about building more institutions in our state, because you would have to fund them through pure state dollars. It's not the best way to treat folks, and it's definitely not the most efficient way to fund beds in our state.
Good answer. So the reason that we've closed down and have not rebuilt is because of federal regulation.
Yeah.
Is that a fair statement?
It is. It doesn't make sense financially or treatment-wise to have large institutions. We have been working with our rural hospitals. The other thing that we did is we allowed our community mental health centers to contract with local community hospitals to buy beds in our hospitals to serve people who are under a civil commitment. So many of the hospitals in our state are now designated mental health facilities who can serve individuals who are under a civil commitment. The problem that we've run into, as you guys know, we have a crisis with our rural hospitals. They're looking at shifting to a couple of new models, rural emergency access, uh, or rural emergency hospital and rural access hospital, which limits the number of beds that a rural hospital can have. And so the strategy of expanding beds, where we were buying beds from community hospitals, is just frankly kind of blown up in our face, because now they're all switching their business model and we're no longer able to buy beds from them. We've just recently lost 30 beds at Bullock County, 30 psych beds that we had at Bullock County for that very reason. We thought we were going to be able to transition. They thought they were going to be able to keep those beds, but through a series of events, they've not been able to do that.
I'm sorry, Ms.
It's okay.
Would you please say that again? I'm not sure I completely understood what I thought I heard.
Which part?
Uh, the aspect that rural hospitals are changing their model so you can't use the beds. I'm not sure I understand that completely.
So definitely not the expert on the rural hospital model, but in essence, if you become, for example, a rural emergency hospital model, that model, based on the way that it's funded by the feds, doesn't allow you to have very many inpatient beds in your hospital setting. And so you might have had 20 beds before, but now you can only have 10. And then you have to decide, are those beds going to be psych beds or are they going to be something else? So the model itself limits the number of inpatient beds a rural hospital can have.
That model is based on Medicaid federal regulation?
Right. And let's see if I can find this slide.
I got one question, Mr. Chairman.
Oh, certainly.
Question.
Okay.
And I guess that's the problem I'm having right here, is understanding the, the changing of models in the rural hospital. Because first of all, our rural hospitals are already suffering. We're losing them. I think we've got some over in West Alabama, maybe are getting ready to close or switch to some other model of service also.
If
right?
I might, AJ, the Thomasville Hospital has never completely opened. It's brand new, and it's up for sale, as I understand it. It's just sitting there with no use, and yet we have this crying interest or need, and I don't understand why it can't be done, but evidently there's something federal, state regulations and payments. Is that a fair?
Mm-hmm. And Grove Hill's another example.
Grove Hill is the other one that I've been made aware of as having a problem. So I'm really concerned about how are we going to provide the people in this state with not just the mental health services they need, but the continued medical access
Right.
that they are going to need. As you move doctors farther and farther away, we are going to end up having fewer and fewer good outcomes as we look out in our society.
And Grove Hill is a good example. When COVID happened and we shut down admissions to our state hospitals because of COVID to try and keep our individuals safe, we went to Grove Hill and negotiated with them to open up a Jerry Psych diversion unit. They had Jerry Psych beds. They had a CON for Jerry Psych beds so that we could admit patients there instead of them being backed up in our other hospitals around the state who were obviously dealing with COVID and needing their beds for COVID patients. So we were able to go to Grove Hill and for a period of time stand up a diversion unit there so that we could move patients there, they could be treated, and they wouldn't be stuck in hospitals, and then we wouldn't have a risk of COVID coming into the Harper Center. That wouldn't be an option for us now. The other unique thing about Grove Hill is it's one of the few birthing hospitals between Mobile and Montgomery. And so this new model, the most recent article I saw says that it will really change the makeup of things at Grove Hill.
So do we have those 10 beds in Grove Hill still available?
We do not.
That's what I thought.
The good news is Harper Center, though, that was a temporary situation. The good news is for Harper Center, which is our geriatric facility in Tuscaloosa, the wait list is very small. And so there are enough Jerry psych beds around the state and private hospitals because there's a good payer for that. Medicare pays really well for that coverage. So we're not struggling for Jerry psych beds. We're in pretty good shape for that. Therefore, we don't have a long waiting list at our Harper Center in Tuscaloosa.
But just to confirm, I'm sorry.
Oh, now, well, this is informal. Yeah, we don't need to ask me to, if you got a question, ask a question. Just don't, try not to step on everybody. Go
Right.
ahead, Senator Price.
Thank you, Chairman. First of all, let me just say thank you for what y'all do. But the model thing to me, I'm kind of surprised that it caught y'all off guard, because this is something that I know that our rural hospitals have been looking at for over a year, 2 years. I have 2 hospitals in my district that one just 2 weeks ago made this change to an emergency type facility. They, with the understanding that I think the way the model is set up, that some of those beds that they have 8 years to actually come back to the model that they were actually under. So that was something. I have another hospital that's very rural that is fixing to happen to them probably pretty quick. So I guess my question is, knowing that this has been out here for this long, why were we not prepared to know that we were going to lose those beds? And you don't really have to answer that, but in the next month or two, I would like for us to have an answer of how we're going to replace that without replacing the answer being a new facility.
If I might specify one, and you correct me if I'm wrong, part of the reason you can't anticipate what Medicaid and the feds will do. Those changes occur um, um, for, in a technical term, willy-nilly, all right? And it is difficult to anticipate how and when those will take effect. Am I off base there, Kim?
You know, every situation is different, and I think, for example, with Crenshaw County Hospital, we had conversations starting probably 2 years ago. And at that time, it was a question of how to interpret the regulations and how many beds could they keep open, or if they, partitioned off certain things like we thought we were going to be able to do in Bullock County, and treated that as a separate part of the building, could they still then open a rural emergency access hospital? So we've been in conversations with different hospitals over the last 2 years, but when the rubber kind of hits the road, what we're seeing is the beds are beginning to go away. And that's the issue that we're dealing with right now is like, okay, how many beds are you going to be able to keep? How many do we need? We do have some other locations where we could stand up beds. There are a couple of options there that, have been a part of our discussion now for a couple of years, Pickens County Hospital being one of those areas. We actually have some beds in our Harper Center facility that are vacant at the moment. Our challenge is finding someone who wants to run those beds and obviously having the funding to operate those beds. So we're searching everywhere, honestly, for beds to see where they are in the state. We work very closely with the Hospital Association on that, but it's a very moving target at the moment, I guess is the way that I would describe it.
And let me just follow up. Like I said earlier, thank you for what you do. And I'm not trying to be critical. I'm just saying that I have been in conversation with these hospitals for now over a year in the direction that they're going in. And I understand that, that from the feds and some of their regulations and how they're going to change and those type things. But I think that as we move forward, the rural hospitals are, I don't mean this in an ugly or negative way, but with the financial strain that so many of them are under, we're going to probably see more of this.
Yeah,
Yeah.
I agree. Sadly, yes. So talking a little more about crisis beds, because I want to talk about this and then show you an example of how it's actually impacting one particular hospital. Our individuals with developmental disabilities, we're seeing much more complex cases. Right now, we have 90 individuals that we're working with in collaboration with DHR, with hospitals, with homeless shelters. These are individuals who need very specialized care, and there's a significant gap for those services. We need new providers in specialized settings for them. We have been able to place 68 children who were in crisis, who were in DHR custody, and 21 adults, but there's still 90 folks on a list of cases that we're working. And just to give you an idea of how that can impact a hospital, this is a report from UAB. So UAB had 27 of our individuals with intellectual disabilities who have very complex cases. Those 27 individuals took up 2,442 days in the hospital. 92% of those days were really low acuity, meaning they really didn't need to be in the hospital for those days, but there was nowhere for them to go. UAB could have served 325 additional patients during that same time, and right now there are people waiting out in communities to get in UAB. UAB emergency department is often going on diversion. So if you have a car wreck in the Birmingham area, you may get sent somewhere else because they're on diversion, because their ER is full. This would have reduced their boarding in the ER by 42% if these individuals could have been served and placed in an appropriate community setting. And 22 additional patients would have been accepted that week for service. And so that just gives you an idea when our individuals, the flip side of the hospital situation is when our individuals get stuck in hospitals, then there are lots of people in that community who are not getting what they need. And those individuals are not getting what they need because they need a very specialized service.
Where,
Yes, sir.
where are these specialized services? I'm trying to grasp this. You're saying that we know we have this problem out here, but the specialized services, what's the barrier to us establishing what we need is all I'm asking.
Right now, there's obviously, and last year there was a request in our budget request for crisis beds. So obviously part of that is for this particular population, for individuals with developmental disabilities. So there's obviously a funding need to develop the specialized services. We do have some groups from out of state who've come in and are working with our existing providers to help them develop the more specialized services. But again, you need beds, you need providers who are willing. We did have a pretty in-depth conversation with UAB about some locations of beds, Whitfield Memorial being a possible location, finding providers who are willing to provide, to be trained and to provide those specialized services is our challenge, and the funding to go along with that. We are also looking at adult foster homes, working with Department of Human Resources. We'll be meeting with them next week. We do think that we can braid some funding between the two agencies. Hopefully we can use our waiver dollars to provide the support the family needs, and then DHR can provide the cost of room and board in that situation. So we really are looking at a way to braid funding to be able to be a little more creative in how we serve these individuals. Okay, so youth mental health crisis. A lot going on in this area. I wanted to show you a couple of graphs. The mental health crisis for our youth is really a very, very serious concern for me and for everyone who has young people and grandchildren like I do. You can see that the increase in depression among girls increased 145% from 2004 to 2020, and for boys, 161%. So that was self-report, and there were some thought that maybe kids just, sorry, that's 24, slide 24. That's self-reported. Maybe kids are just more aware of depression and anxiety now, but the graph next to it shows you the number of kids showing up in an emergency department because of self-harm. So the other graph shows you that, yes, that's what kids are reporting, but in fact, kids are showing up more often in an emergency department because of self-harm. 188% increase for girls and a 48% increase for boys. So social media and its impact. Here's something I want every policymaker, if you don't remember anything else I say today, here's the stat I want you to remember. Adolescents who spend more than 3 hours a day on social media face double the risk of anxiety and depression. The average used right now as the summer of 2023 is 4.8 hours. Adolescent social media use is predictive of a subsequent decrease in life satisfaction. What can we do about it? No smartphones before high school, no social media before 16, phone-free schools. I'm just saying, it's a good thing. More independence, free play, and responsibility in the real world. Why? Why do we want to do that? What is this phone-based childhood doing to our kids? So
Hold on for just a second. I just want to make sure that everyone heard what the mental health department committee person, expert just told us. Social media is causing the mental health crisis that we're having in our youth. Is that a fair statement?
It is. And here's what it does. So when we were kids, we went outside and played. Our childhood was a play-based childhood. You went out with your friends. But when smartphones came along, it shifted to a phone-based childhood. Kids stayed in their room. They were on social media. They were not interacting with others. What does that cause? It causes social deprivation, sleep deprivation, attention fragmentation, and addiction. So the graph that you see here shows the daily time spent with friends by age group. As you can see, it dramatically decreased. So kids 15 to 24 are not spending time with friends. Here's the other issue for me as the mental health commissioner. If you're experiencing trauma, if you're having some other mental health issue, one of the best things you can do is to be engaged and connected to your community. So here we have kids who are not engaged and connected. And then if they also have a mental health issue, or they have adverse childhood experiences, or they have trauma, they are not in any way prepared to deal with that. All of the things that we would encourage them to do are in opposition to what they're doing sitting at home on their cell phones. The things that we would encourage them to do to build resiliency would be playing sports, being involved in activities. All of those things are the things that are important for our youth so that they can have good mental health. It causes addiction, especially for the kids who are doing video games. It's the same kind of dopamine as people get when they go and gamble in the slot machines. There's a little bit, it's set up that way. They use every trick in the book to be able to get kids to continue to click. So it is a huge issue that there's a lot that we can't do anything about when it comes to mental health. This we can do something about. Yes.
Any
Okay,
comments
no.
or questions from
Question.
anybody on that?
Question right here. I guess I shouldn't have come today, y'all.
You came in late, but you'll leave early to make up for it.
I'll do whatever you need me to. and I'm looking at it and hearing all of this stuff, but I'm a person, I try to find solutions. And one of the ideas that just came to mind, it may be a harebrained idea, but what kind of relationship do you all have with the Department of Education in terms of we can oftentimes we try to address something by putting a bandage on the scar, but we need to try and get to the cause of that scar. Have there been any collaboration with the Department of Education to actually put this information in the hands of parents?
We do have an extensive collaboration with State Department of Education. We have 109 school-based therapists in school systems across the state. We work collaboratively with them on what they call the multi-tiered system of support. Uh, from an article I read last week, I think the State Board of Education passed a resolution in regard to phone usage and encouraging schools to get phones out of the school systems. So there's a ton of work that we're doing and will be doing over the next couple of years to educate parents. We've been in conversations with PARCA about making this a topic for their policy academy that they do in February or March of next year. And so we're honestly trying to get the word out to everybody that we can. But it is certainly on State Department of Ed's radar. It's a conversation they've been having as well, and we are really in constant communication with them about how to use the mental health service coordinators, the mental health therapists, and others in the school system to improve the mental health of students. But the beauty of the phone thing and getting phones out of school is really also, you've heard, I think you had some folks come talk to you, maybe from Montgomery, and teachers talking about how much better it was in the classroom because kids were engaged. So then you get teacher satisfaction. I mean, sometimes there really is a simple thing we can do to improve the overall mental health and well-being of folks in a school setting. Okay. So one of our other initiatives, our Stepping Up initiative, that is putting a case manager in a jail setting so that we can get people with mental illness and substance use disorders out of jail. We are really expanding this program. Again, this is a collaboration we have with the Alabama Association of County Commissions. In working with them this year, we reissued the application for the Stepping Up initiative this past year. So in 2025, we will have 30 new counties that we will be working with so that we have that case manager in the jail setting so that that individual who is in jail and has a mental health issue or a substance use issue can get to where they need to go to get treatment. So this is an initiative that we really felt like we wanted to expand. And working with the Association of County Commissions has really allowed us to do that. The sheriffs, the probate judges, and those folks are really very supportive of this effort and will be going down to their conference in August to talk more about this initiative as well as the integrated mental health and substance use treatment for using local opioid settlement funds.
So if I might, this is being the Stepping Up initiative dealing with the sheriff's issues and the probate judge's issues. Is that correct?
Some of them, yes.
Some of them?
Yes.
Some of the issues or some of the probate judges and some of the sheriffs?
So mainly the sheriffs, because this is happening in jails.
Right.
And what we're doing with probate judges is, do they need to go through a probate commitment, or is it someone who can actually just go right on to
Go
treatment?
directly into the center and then go. Are you, in this initiative, are you coordinating with the various and sundry mental health courts that have been set up?
Some of them in counties where there's a close working relationship with the sheriff, we are, but I won't say that we're doing that across the board.
So when a mental health and circuit court or district court mental health is set up, mental health court, there's not a coordination with your office as to how or what they do?
In some communities, the community mental health centers are doing that, but I would say that that is not across the board for all the drug courts or the mental health courts. That is a conversation that we have a member on the opioid commission, Judge C, that we've had some conversations with, and as the administrative office of courts and all the changes there happen, it's a conversation that we really need to have with them about how we better coordinate that.
Yeah, because if we're setting up mental health courts, uh, the expertise comes into question. I think the treatment comes into question.
Right.
Are we duplicating services between what's happening there? Lots of questions come into play. So that was one of the things I wanted to ask you about
Yeah.
today. Is we have a lot of those, and they're growing. They're doing fundraising and asking for funds in different ways, local and state. And yet if they're doing things that's outside the realm of DHR or yourself or somebody else, who are they coordinating with? I don't have an idea on that yet, and obviously you don't either.
I've heard good things. I think there's a lot of interest in that as, we go through an election and we have a new Chief Justice. I think the conversations and a partnership with the Administrative Office of Courts is going to be critical this next year. I think it's a little challenging for us right now because they're in a transition time. So I think having that relationship moving forward and working with them, everything that I've heard so far is a huge interest in trying to resolve how we get folks where they need to be when it comes to mental health and substance
I
use
agree with the
treatment.
goals. I just concerned with the procedures
Results.
and the effects and those things. So a better coordination, I think, would be helpful there. But I'll leave that to you for some further guidance along that line.
We did
we-
have a really successful judicial conference last December with Administrative Office of Courts, made some headway, had our community mental health centers, judges and juvenile court judges around the table together, but there is plenty of work to be done. I would not stand up here and say that we've figured it all out.
I think, Mr. Chairman, if I make a comment, I know in our area, and it does vary across the state, as the commissioner brought out, and we did allocate some opioid funds for grants for these courts and for all courts, for drug courts, mental health courts, and veterans courts. And we think that grant process will facilitate what you're saying is just more collaboration. But I know locally, sometimes these individuals are adjudicated directly to a local community provider there
Right.
in that area. So I do think we're probably using the same providers, and some of it's direct, but some of them do need some support from us.
Uh, it, and that would be, I guess that would be odd, but you're right. You've got mental health and you got veterans courts and other specialty courts. And again, they're sending folks through similar providers or similar resources, I guess. But the coordination, are we dealing with the same people is the other question I have. If you're dealing with the same people doing the same thing. Anyway, I'm a full in favor of being efficient and when we're trying to deal with people procedurally and effectively. But just me.
Deal. We have done a significant amount of crisis intervention training for law enforcement across the state. We have a director of CIT, Johnny Hollingsworth. So this is just a slide to show you the amount of law enforcement training. You have a $450,000 investment in that training, and then you also appropriated some additional funds in 2025. And so you'll see increased numbers in law enforcement training, over 1,300 who are the 40-hour CIT trained officers. And then the focus as Spectre Care opens in the Dothan area, that will be Johnny's focus moving forward, just to make sure as that crisis center opens in that community and they're really engaging with law enforcement, we have well-trained law enforcement officers who know how to de-escalate a mental health crisis. He's done a phenomenal job. He's a pretty amazing guy if you haven't met him. You have made investments in substance use treatment, really some investments that we haven't seen since the 1970s. And so we have seen a lot of funds come into the state, particularly grant funds for the opioid response. We are doing a program called Building Bridges in the jail in Walker County. So we're actually doing medication-assisted treatment in jail in Walker County. That's the first time we've been able to figure out how to get that done in a jail setting. So we're very excited about that program. We are going for another grant that would allow us to expand that to other jail locations. We did open 4 recovery centers in the state. That funding was appropriated in 2023. All are currently operational, which brings us to a total of 8 statewide. We did, for the first time, have that increase in residential treatment beds. We currently have 4 centers. 2 are operational, and then the other 2 should open in late July or August. So you've invested in substance use treatment in a way that we haven't seen in quite a few years as well. We are moving to a very specific model of mental health care. You've heard me talk about the Alabama Crisis System of Care. But this is a federal model of public community mental health care that many of our states have already moved to. It's called Certified Community Behavioral Health Clinics. You'll note that to be a certified community behavioral health clinic, you had to have crisis services. And so building out the crisis system of care is really, really important for us to get to this point of having an integrated care model known as Certified Community Behavioral Health Clinics. Alabama was just recently selected as one of 10 states to become part of the Medicaid demonstration program. So over the next 4 years, we'll be experimenting with this program and looking at building this model out in the state of Alabama and looking at how we can maximize Medicaid reimbursement for those services. We have 2 community mental health centers that will be certified, that are already actually certified now, Alta Point and Wellstone. And this is the model that we'll be using going forward in our state. You look like you had a question. Okay. Okay. Yes.
And the general fund committee did increase some funding to those community health care centers, right? Because I think I heard where like 45% of the individuals served there do not have insurance. And I think through that 90-10 match, we may make a difference there with that additional funding.
Yes, you've made pretty significant investments in workforce for them and trying to bridge that gap for individuals who are not covered under Medicaid. So there have been significant investments there, which is enabling them to be able to be prepared. Honestly, all of that is what made Alabama's application a viable application. We're the only Southeast state that was selected. I'm just extremely grateful to our community mental health centers and to our staff who worked literally practically night and day together trying to make sure that we were competitive in getting this grant. There are a couple of positions within that Certified Community Behavioral Health Clinic model that we see as an opportunity to begin to build a career track for community mental health professionals. There's a care coordinator and an outreach coordinator that really you can have a high school diploma and 2 years of experience and be in those positions. This is one of the first times that we've had that kind of entry-level position. Usually we're telling you got to have 4 years or 6 years or 10 years of experience and lots of initials behind your name to get into our system. And so that's one of the advantages of CCBHC is it does allow for professionals to come in at that level, then be trained and get their education and move up through the system. So we're very excited about it, not only from the treatment standpoint, but also from the standpoint of workforce development. Veterans mental health. You heard Admiral Davis earlier, I guess yesterday maybe. Veterans mental health is an issue in our state. We have a very high suicide rate for veterans. That is obviously of great concern. We have many, many veterans in our state. We know that 1 in 10 veterans are diagnosed with a substance use disorder, and we also know that veterans with traumatic brain injury are at great risk of suicide. That combination of brain injury and substance use is the two biggest risk factors for a veteran potentially uh, choosing to take their life. There are some federal policies out there. You heard Admiral Davis talk about 988 and getting services through 988. We do know that 32% of the calls to 988 are veterans calls right now. So we do believe there's some opportunity there through the Alabama Crisis System of Care for veterans to receive some services. There was legislation sponsored by Senator Jones and Representative Brown this year that is establishing a Veterans Mental Health Steering Committee. And so we'll be working in conjunction with the Department of Veterans Affairs to develop a comprehensive plan to address the unique needs of veterans in Alabama. Item number 2, I guess I would say this is really where we want to be. We want to maximize any opportunity for veterans to access care no matter where they need it, no matter when they need it, and no matter if they're enrolled in VA care. There are several exciting things on the federal landscape that are happening that would improve the opportunity for veterans to be able to access care no matter where they are. So we'll be working with some other experts because that's not our area of expertise. But there's some things that are really a game changer in terms of veterans being able to access mental health care no matter where they are and for it to be reimbursed through the VA system. And so I'm really excited about it. I think it's going to be a very productive time looking at how do we better serve our veterans in the state when it comes to mental health care and substance use. And so we're looking forward to that.
Thank you for all that, and I appreciate you addressing that, the bill and the other matters that's there. It's going to take a lot of coordination. If I'm as a veteran myself, I can tell you that one of the issues that us veterans have is um, our ears are only open to those that have similar experiences. Vets helping vets. They have a tendency to understand and use the same language that's different from other professionals, if I might, and they're easily recognize each other. And so my point is, if there is a means or a way, and now this is a simple suggestion, in developing this comprehensive plan that's coming in, finding a way to get more vets trained and involved in turning to those that are not doing as well as most. Um, if that's something that might be a consideration, I would encourage that.
Absolutely. Any other questions? I think I covered most of what's in the packet.
Any questions from anyone? I
All
would
right.
suggest that we have a long way to go.
We do.
Um, we are all trying to find our path to meeting all the needs that's here. This is one issue that Alabama has had a tendency to ignore, mostly because of financial and other reasons. We're trying our best to help and assist to get you, Ms. Boswell, moving forward and getting everyone else on target here. If there's anything that we can do legislatively to help bring things together, to help make sure that we have the roof covering all that are in the rain, if that makes any sense. If there's anything that we can do to help better coordinate these matters, regionally or otherwise, please give us that guidance. We're anxious and we want to. Sometimes our efforts get in the way of you guys or others, and we stumble over ourselves. Don't let us do that if we can help it. Let us try to work together to find a way to help our people that need it. I would reiterate what Mr. Fulford went into yesterday, a cautionary aspect of where we are financially and where we may be. We're coming off a high. All the COVID money will be spent. I'm not certain how much or if we receive federal funding and such from others. Uh, all the municipalities and counties are having difficult times also. We've already talked about mental health, rural hospitals in regard to mental health. If there's anything we can do in regard to that, to make these paths easier, to delineate what can and can't be done so that we can salvage as many hospitals as we can and provide the services in a more reasonable local way. We're anxious to do that, but we got to have a plan to accomplish that. Bits and pieces won't work.
Right.
Those are my comments. Anyone, Mr. Chairman?
Well, I kind of echo the chairman's thoughts, but I will tell you that Alabama was fortunate that I think the timing of your vision on the crisis system of care, Governor Ivey's challenge to this legislative body to expand access to mental health in Alabama kind of began there in late fall of 2018, early 2019, and your graph charts with that. But we don't move that kind of money without leadership being involved. So certainly appreciate you and the governor and the speaker and the pro tem all supporting that joint legislative committee, which will be codified in the 25 session. I do, kind of going back to my earlier comments, I absolutely do believe it's increased access to care through our crisis system. I do think we need to do a better job on our mental health for our veterans, and I think the steering committee and I saw that look at that the makeup of that committee, and I think y'all are the right people to make that vision happen. But I do think before we begin expanding the number of crisis centers, we've just got to really sit down and have some tough conversations about how to fund those going forward, or we may jeopardize this infrastructure that we put in place. So thank you for all you're doing and continue to do.
It is an honor and a privilege to serve with all of you. The collaboration with the members has just been absolutely phenomenal. It is a great joy for me to be able to work and address the needs of the citizens of Alabama. So thank you.
Well, thank you for saying that. We know we're difficult. Kirk, you had a question or comment?
Just adding, all the presentations from today and the information we gave you are on our website. My presentation from yesterday is on the website. I want to make sure that you understand that the information we gave you yesterday was not our projections for revenue over the next few years. I was showing you what could possibly happen over the next few years and timing and dropping off on interest on state deposits. That's something that I just wanted to make sure that everybody was aware of, and that especially these committees as you're trying to craft the general fund budgets over the next few years. So that's all I have.
Thank you.
See you in August. We'll have another update.
All right. We'll be doing this again with other agencies in August. Now, if I might turn to the members, what do y'all think of the hearings? Have these been useful for you guys? And if so, how?
Yeah, well, thank you, Mr. Chairman. If I could just
Certainly.
say hello and thank you for calling the meetings. I think we've recognized that the needs are great and the cost is going to be high. And I think as we move forward with the flattening of the economy, the unknown on the interest rates and things of that nature, we as committee members need to take a strong look at any legislation or anything like that that's going to take money out of the general fund, and if it'll negatively affect the general fund. I think these are some unknown times. We're living on some false highs, and that just concerns me that as we move forward. So I think we need to move forward cautiously as a committee. That's just my comments. Thank you, Mr. Chairman, for having this and calling us.
Thank you. Any other comments or questions? I would call attention that we're going to be beginning processes. The executive will begin doing budget developments in the fall, about September, October, I think, and be running those rabbit traps. So we're a little bit ahead of the game in regard to this so that we can start gauging what we're going to do. I want this body to understand that the obligations that we have are tremendous. If you look out that way in the back, you'll see one obligation that we're on the hook for. We got to find a means of paying for. I got a request in that's going to cut potentially $8 million out of the general fund every year for a while. We've got to make a decision on that. And then we've got prisons continuing to be constructed, of which the borrowing power is going to be quite limited, not because of our credit rating, but because of the politics of it. So we've got a lot on our plate that's got to be dealt with, and we're coming into some unknown time frames of how we're going to be able to face it. So Representative Witt's comments should be taken. So I call these to call attention to those matters, to educate individuals, and to get us on the correct path for the next few months. That's all I got. Mr. Chairman, any other comments?
I agree, absolutely. I do think, and I think we lean on Kirk and his team, but I think we'll have a good, strong budget in '26. We've got some commitments that I think this body has done a good job committing funds to for the last 2 or 3 years. We need to finish those obligations while we have funding, and then I think it'll tighten down. We've been very fortunate with these supplemental appropriations, but the '27 budget on probably won't see those kind of numbers again. So, thank you, Mr. Chairman.
Thank you. With that, oh, I'm sorry. Yes,
Just one quick thing. For me, seeing it from a dollar to a purpose is what has helped me with this. And so I have enjoyed these and look forward to August. Thank y'all for being here.
thank you. Thank you for your comments and your participation, both this body and our agencies. We'll stand adjourned until August.